everyone! In today's brief video, I would like to tell you a little bit about the variety of pathways toward careers in the mental health helping professions. I'm making this particular video because I get a lot of questions from students about essentially how do I become a therapist? What's the best way to go? How do I do this? What are my next steps following my undergrad degree? There are a wide variety of options that all can lead to meaningful, lucrative careers in which you are working to help people with their mental health and to better society. And one of the key things I really want to offer to students is the awareness that there is, again, a plethora of options. My background is a PhD in clinical psychology, and many students seem to assume that that's kind of the only way to be working in this field, and there's actually a lot of different routes out there. The PhD in clinical psych is a great way to go, but it may not be the best fit for everyone. So one of the things I like to do with my undergrads is to make sure that they're aware of the many different options that are in front of them. So in this video, I would like to tell you just a little bit about 4 different career pathways, 3 particular routes within psychology, and then 3 training models within psychology. And that's really just the tip of the iceberg in terms of seeing the array of options. But let's jump in. Okay, so the first career pathway that I'd like to mention is psychiatry. Many students, by the time they've reached some of the upper level classes that they may be taking with me, they may already realize what psychiatry is and how that differs from various psychological careers, but I'll just mention it very quickly. A psychiatrist would be one who has earned an MD and then focused in on mental health and went to a residency focused on psychiatric care. So from a bit earlier in the process, your focus would be a bit different, right? You're going to be thinking more about the biomedical end of things. You're going to be learning about the whole body, anatomy and physiology, a wide array of how genetics and your physical health and your neurochemistry all relate to functioning and mental health. Now, granted, psychiatrists do therapy, but these days, especially where we're located, most psychiatrists are focusing more on medication and management of some of the more severe end of things like, say, schizophrenia or bipolar type 1. That's a broad characterization, right? There's going to be a lot of variety. But that would be a quick overview of psychiatry. And again, the key way that that differs from most of the other psychosocial oriented forms of treatment is going to be that a psychiatrist is going to go to med school after undergrad, right? So that's just categorically different than the folks that are going to be going to some graduate school of some sort that's focused on mental health. Okay, but so first is psychiatry. Second, I'll mention social work. A lot of students don't realize that social work is a valid route for people that want to become therapists. Again, my commentary here is pretty particular to my local area, so Michigan in the United States. But around here, social workers, particularly clinical social workers, are doing more outpatient therapy or providing more hours of it on average than our doctoral level psychologists. There's a lot of need. There are a lot of clinics that offer sort of standard once a week kind of therapy care, and social workers fill a lot of that need. There's this stereotype that social work is exclusively about the criminal justice system or about foster care or about working with families that are going through a divorce, and certainly some of those things are relevant for the careers of some social workers, but that's actually a really narrow view of what they do. Social workers are involved in a wide range of different kinds of human well-being care, and one of those is psychotherapy. So for those of you that might be interested in that, I'll point out that in the United States, social work training programs tend to be labeled as either a macro track or a micro track. So the folks that go and earn an MSW in a macro track, they're going to be studying things like societal level care, right? So advocating for policies that will make things better, setting up social services of various kinds, trying to make an impact on a somewhat bigger macro level. Whereas the folks that are trained in micro social work are learning about mental health. They're learning about various ways to treat individuals, couples, families, children in school systems, and working with them to sort of minimize their suffering and maximize their functioning. Okay, so be aware that that is a set of options. And when I say MSW, that's the abbreviation for Masters in Social Work. Many of those programs are about 2 years. Some are a bit faster, some are a bit slower. But for a lot of students, that's a reasonable route toward becoming a therapist that I want to make sure they're aware of. Okay, third career option that I'll mention is counseling. And importantly, this is a bit different than counseling psychology, which I'll get to in just a bit. But counseling is another primarily master's level training route that one could go to. Those programs tend to be housed within departments of education at universities. Folks who train in counseling, again, are going to be primarily interested in mental health, and so one of the primary services they offer would be a talk therapy of some kind, often on an outpatient basis, but you may see counselors also employed in hospitals or in inpatient settings of various kinds. Here in Michigan, the license that you would earn after doing a master's in counseling and after being in supervision long enough is an LPC. Again, for many students, that's a viable option. Many of those programs are about 2 years, so in some ways it's similar to earning an MSW. The fourth career track option that I'll mention is psychology. There are many options within psychology in terms of how you specialize and how you make it into your functional career. They vary from master's level to doctoral level with some other specialty options in there. But again, many folks who are working toward mental health careers in the psychology topic area are going to be doing similar sorts of activities, whether it's outpatient therapy on a one-on-one basis, working with families, working with couples or groups, located in hospitals, located in outpatient clinics, located in schools or universities or prison systems, right? There's a pretty wide variety. The licensing options available for psychologists would include the LP at the doctoral level. So that stands for licensed psychologist. That's what my licensure level is. I'm an LP. At the master's level, you can earn an LLP, which is a limited LP. It allows you to do many of the same things, but again, sort of similar to the LPC, you'll be spending a longer amount of time in supervision with a senior clinician. It's not a bad thing. Supervision is a really important part of growing in this field. But again, some folks may wish to work toward independence sooner. There's some trade-offs, right? So at the master's level across the board, whether it's folks doing counseling, folks doing social work, folks doing clinical or counseling psychology, the master's is going to be approximately 2 years, and there are a pretty wide variety of institutions that offer that degree. The doctorate is going to range from, say, 5 years to 7 years for most fields. And in psychology in particular, there will be a pre-doctoral internship that comes at the end. So that's often year number 5 or number 6 for most people. After graduation, most people go on to do a postdoc or a postdoctoral supervised experience of some kind, which is often a year to 2 years. And at the end of that, if you've passed your licensure exam, then people are often ready to step into fully independent careers of some kind. Okay, I know many of these details might be a bit over your heads, focusing here at the beginner perspective. What do I need to know looking at these different options? What would help me going forward? Okay, so probably one of the first things you would want to be deciding as an undergraduate is which of those 4 things am I most interested in? Psychiatry, counseling, social work, or psychology. And then given which of those best fit your interests, you would be pursuing a medical school or graduate school fitting with those philosophies. Okay, like many things in mental health, we can think of it as ranging on the biopsychosocial spectrum. Psychiatrists are going to be a bit more focused on the biopsycho end of things. Psychologists and counselors are going to be thinking more in terms of the psychological, and social workers are going to be thinking a bit more in terms of the psychosocial, right? The Everybody along that spectrum is interested in all three, right? It's not to say that a psychiatrist has no awareness of how racism impacts people, and it's not to say that a social worker has no awareness of how SSRIs work, right? It's important that these professionals are trained along that whole spectrum, but you would choose your eventual career pathway based on which one you think most aligns with your interests and aligns with your strengths as a provider. Okay, so those are the 4 career track options. Next, I want to mention within psychology the 3 specialties that would be mental health oriented, and those are clinical psychology, counseling psychology, and school psychology. They share a lot, right? They overlap more than they differ. I want to make that point right at the outset. But to characterize them a bit, clinical psychologists tend to be a bit more interested in thinking about mental disorders and suffering that is maybe a bit more on the severe end of things. They also tend to be really interested in assessment and psychometrics, and they also tend to be a bit more interested in neuropsychology than the other 2 areas. Counseling psychologists are also interested in mental health, but they might be a bit more in tune to things like vocational training, suffering in the forms of more average experiences, so depression, anxiety, grief, loss, divorces, life changes, those sorts of things. And like I said, they might be a bit more interested in vocational interests, so helping people identify what are my interests, what are my strengths, what sort of career should I be going into, right? So a counseling psychologist may take on some of those capacities in terms of vocational assessment and helping people figure out what's their best fit in life. And then third, there are school psychologists, and I think this area sort of suffers from being a well-kept secret. It's a growing industry. They actually need more school psychologists, and it's a great option for a lot of our students because a lot of the students I talk to have an interest in working with kids. They find school systems fascinating, and they want to be able to make a difference for people's mental health. Well, school psychology does all of that, right? So this is, again, a psychologist. It's someone who's trained in the biopsychosocial model and is fascinated by mental health, but they tend to be located in school systems. So they may consult with teachers and principals. They may be a primary source of care for the students on site. And they're also going to be very involved with things like testing and assessing students for learning disabilities, ADHD, other sorts of things that might lead to building an IEP or an individualized education plan, and helping the teachers and other relevant folks to execute that plan successfully. So school psychology sort of exists as the bridge between education and mental health. So those are the 3 sub areas within psychology that would be the most mental health oriented: clinical, counseling, and school. Again, they share a lot of overlapping interests, but do some thinking about what likely fits your interests the best, and then begin to look at graduate school options in those areas. Lastly, I'd like to mention that there are 3 training models in the graduate school process for psychology, and these cut across the variety of school, clinical, and counseling psychology options, right? You'll see these training models in all 3 of them. Okay, they sort of exist on a spectrum from most focused upon practice, right? So training people to become clinicians, from being most focused on academia, scholarship, and research, right? So training people to become professors or training people to be the folks that would bring in grant money, run large-scale studies, run clinical trials, that sort of thing, right? So you can sort of think of a spectrum there. I'll start with the one that's in the middle. The scientist-practitioner model is situated directly in the center of this practice to science spectrum. So the scientist-practitioner model is going to be embodied in a graduate program that sort of equally trains students to be researchers and clinicians. Your program will likely involve a lot of collecting and analyzing data, taking courses in statistics and research methods, but also taking courses on theoretical orientations to treatment, understanding the origins of various families of mental health treatments, and a lot of supervised practice for how to be a good provider. This is the oldest model. It's been around decades and decades, And this model attempts to train people to be both wise consumers of research, producers of research, and people who can apply that research in their various applied careers, whether it's seeing clients or consulting in some other fashion. Okay. Next, I'll mention the practitioner-scholar model. So this is the model that's going to be most focused on applied practice. These sorts of graduate training programs are not going to ignore research, right? You're still going to be doing likely some sort of data-oriented dissertation project in order to earn your doctorate. But the majority of your training is focused on applying what is learned from the research that's out there to the clinical setting. This is going to be a better fit for folks who may ultimately want a full-time private practice or a full-time applied career of some kind, and who may not be quite as interested in producing scholarly research articles, writing books, that sort of work. Lastly, on the far end of the science or research-oriented spectrum is the clinical scientist model. So this training model, like I said, is hoping to develop people into roles where they are leading the way in terms of developing new research. R01 university professors, folks who run clinical trials, folks who are developing treatment manuals, they're really focused upon the research work that's going on. Okay, and I'll give you some examples of all three of these models, right? So most of the programs that are out there are going to be scientist-practitioner models, which primarily offer the PhD as the degree upon completion. Again, that's what my background is. My training program at St. Louis University was a scientist-practitioner model PhD program. Here in Michigan, there are a number of programs like that. So if you go and earn your doctorate from, say, Central Michigan University, and a number of other programs in the state, that's the sort of training that you would get. It's a balance between research and applied practice. On the practice-oriented end of that spectrum, the practitioner-scholar model, there's one institution in Michigan that embodies that model, and it's called the Michigan School of Psychology. A number of my alumni have gone on to study there, and they've had a great experience with it. Those sorts of programs tend to award the PsyD as the degree that you would get upon completion. And that's sort of exclusive to the practitioner-scholar model, is that you would earn the PsyD, so it gives kind of a labeled difference in focus. And then lastly, again, the clinical scientist model, those also award PhDs. And here in the state of Michigan, the best example that comes to mind is the University of Michigan. Their clinical psychology program, I think, would be best categorized as a clinical scientist model, right? They're really focused on building top-tier researchers. Okay, so again, when students are asking me questions like, well, where should I go to graduate school if I want to become a therapist? I think what tends to happen is I respond to them with a bunch of questions. Are you interested in research? Do you think that you'd eventually like to be a full-time therapist of some kind? Or do you have an interest in scholarly work? Do you want to be a supervisor? Or do you just want to be seeing patients? It's not so much about the fame of the university that you choose. It's more about choosing a program that fits your goals. These psychology training programs are often relatively small. You might be entering with a cohort of maybe 4 or 5 classmates, maybe as many as like 40 or 50, but for many of the universities in the state, you're going to be a part of a pretty small cohort that is getting a lot of hands-on training from the faculty, so that by the end of your time there, you are this well-rounded, polished graduate who is ready to go on and be the field of psychology moving forward, right? So I think that's an important thing to point out, is that it's not just about what's the best graduate school, it's what training program best fits my goals. Okay, so to recap, it's really important for students to know that there are a wide variety of options out there. You can be looking at psychiatry, counseling, social work, psychology. You can be thinking about clinical psych, counseling psych, or school psych. And within the psychology training options, there's even more variety because we've got this spectrum ranging from the scientist-practitioner, the practitioner-scholar, and the clinical scientist model that give a lot of variety to the kinds of training and options that you might be looking for. And there are a number of other helping professions that I haven't even mentioned. All these other branches and sub-areas of the various psychology and counseling techniques, like art therapy or music therapy or applied behavior analysis. There truly is just a lot out there, and ultimately it's going to fall on the student's shoulders to do some research and figure out what really is the best fit for me, what is of interest to me. But I lay out this framework of the different categories to sort of get you thinking at the start that there are many options, right? I don't want students to make the mistake of thinking, okay, this particular path is the only way I can do this, let me figure out how to get there. I want you to look at an array of things and figure out what's best for you. So with that, I will just end by saying it's good to ask questions, right? So don't assume that just because you've watched this video or maybe you've read some materials online that you understand the whole landscape of the mental health helping careers and you know exactly what to do. Talk to your faculty members, talk to providers in your area and ask them questions like, do you feel fulfilled in your career? How did you end up here? What sort of training model was the program that you studied at? Get to know them. Try to figure out what seems like it's the best fit for your individual needs, your goals, and your life circumstances, right? Not everyone is coming at this in the same circumstances. Some people are going to need the flexibility to work through classes part-time while they are working or parenting. Other folks really just want to dive in and they have the privilege to be able to really focus on nothing but their career for a few years. Some folks are able to relocate geographically, and that's going to be an important consideration if you're applying to more competitive kinds of programs. Other folks need to be able to stay local, and so they need to weigh the pros and cons of those different considerations. And that's okay. Just take some time to think it through and decide what's best for you. I think there are a million ways to become a mental health helper. Even if you don't become, say, a licensed provider, maybe it can just be something that is a part of your personal life, right? That you've studied this topic and maybe you engage in philanthropy, maybe you volunteer on the side, maybe you are a voice in your community for change and betterment of people's lifestyles. That's all wonderful. But if you really want to pursue this as a career, it's good to start thinking now about what's the best path for me. So I hope this was useful. Don't hesitate to reach out if you have questions. Look around and figure out which career is going to be the best for you. Take care, everyone. Have a great day.